2012, but we were early adopter and we brought it very early to Crookston. So we have been doing this procedure since 2012 in Crookston. So our team here is one of the most expert on this kind of procedure. Practically, we just did a surgery in 1 hour, a 3-level fusion. This surgery, even in the most advanced places on the planet, would take 8 hours to do. And this patient, after this kind of surgery, after open surgery, because we produced so much destruction of the tissue, they stay in the hospital a full week. Most of my patients, even after this surgery that I did, they go home within 24 hours. Like this surgery that we just did, our blood loss was 72 cc, which is a little about more than 2 ounces. In a regular surgery, after this surgery, the blood loss would be 2000 cc. So we are able to reduce drastically the blood loss, damage to the tissue, and significantly improve that. And all of that here in Crookston, because we were early adapter and we have developed it, and now we are expanding toward the city. There's almost not a week or month that we don't get international visitors to come and learn this procedure. And as a matter of fact, this is one of my favorite places to do this surgery, because my team here is very well versed and trained to do this surgery with us.
Okay, and my understanding, like you said, it takes a couple hour procedure down to maybe an hour or so, and the recovery time way down. How does it differ from an open procedure?
Yeah, very good question. You know, open surgery, for lack of other terms, we are filleting the patient open. We're spending a lot of time to fillet the patient open, and because this is a living person, it bleeds, so we spend lots of time to stop the bleeding. We literally cook the tissue, and that produces dead tissue that can get infected and so on. All of that falls away with this procedure. We use a tube system that is literally a little bigger than a pencil to get to the bad disc or pathology, and then with very specialized tools, we are able to do this surgery over a tube that is minimal. By the time we take the tube out, there's no scarring, and most of the effort in a surgery like this is to get there. We get there with this very specialized tool within minutes, whereas in the open surgery, they need hours to get in.
Okay, excuse me. And you said you get a lot of international visitors, a lot of visitors who come to observe this procedure.
Yes.
Today you got one, but can you just kind of talk about who's all come to see and who?
No, still nationally and internationally, most of the surgeries are done old-fashioned way in the spine. Meaning we literally open up to people, cut a lot of tissue to just get in, but minimal invasively is advancing very rapidly. We in the United States are in the far front of it, but still in the United States, 80% of the surgeries are done open old-fashioned way. So we are spearheading this kind of technology to make the surgery minimal invasively. And so we get lots of attraction from experts around the world that are willing to learn that. Like we got from Saudi Arabia, from Riyadh, from United Arab Emirates, many people from Germany, and as well people from Central and South America coming and learning this technique from us. But as well, more importantly, that in the United States, we are literally the authority, if not internationally, nationally, definitely we are authority on this procedure. What that means is that we published all major published paper about this procedure. We have done major clinical work, and this has been recognized, and people come to us to learn this procedure. And most of the time, you know, we are able to as well accommodate them with a cadaver lab, or what we introduce actually a porcine lab. We teach them the technique. They don't just watch us in surgery, but we teach the technique on them on a cadaver or a porcine lab. So, and then we enroll them in a process that's called soft transition, because this is a very technical procedure. This is not one of those procedures that you can just watch it and go and do. And many people who try to just watch it and go and do it, they end up doing this surgery in 5 hours, and then lots of things can go wrong and so on. But we have put now a training manual, so to say, to actually teach it. And our track record is people who learn it our way, they are as good as we are here in Crookston. And people who learn it the other way, they literally, you know, they give up because it is hard thing to do. We call this process soft transition, and as a matter of fact, we have track record of a surgeon in Missouri and Dr. Kim here. Once they get into the soft transition, within a year, they accumulate like 5 years of experience, or within 3 months they are absolutely ready and comfortable to do this procedure. Whereas because this surgery is so different, anybody who has just gone to a weekend course to learn it has failed actually. So we are more than just doing the right thing and doing it very well. We are the authority on the planet to teach it.
Great. All right, well, thank you.
Well, thank you very much for the interview.
Yeah.